Okay, we all got to count the cost, and the cost of this one is a big one. During these high inflationary times, everything's costing more. And I wanted to create this video because I wanted to save you some pain that I think I saved myself because I was on a path to developing type 2 diabetes. I was already pre-diabetic, and thank God my doctor kind of got me to say, to see the light and say, if you don't do something now, you're heading that way. So I'm not here to be like, prophet of doom and try and just scare you. I'm here because this is what I found out in my life that I needed to do to prevent myself from going down this road. And I want to talk to you today. We talked about prediabetes in another video recently. Now we're going to talk about, unfortunately, if this does develop. And here's the data. I'm going to be relying a lot on my notes during this podcast. This is a podcast video cast, so if you don't want to see my face, you can listen to me on Spotify and just go and search for RX Healthy Habits, and you can find all our podcasts on there. And this one is one that I want to make sure that I put on there so that people, if they're driving down the road, they can get it. Longer content, if it's a video that you prefer, it's going to be a longer content, but the information's, I think, extremely valuable. So here's some data. I don't know if you knew this, but 37 million, yeah, easy for me to say. 37 million Americans right now, 1 out of 10 Americans, adults, 1 out of 10 adults, have type 2 diabetes. Think about that. 1 out of 10, 10% of the population. Obesity was linked to the development of type 2 diabetes for these people in 30 to 55% of the cases. Now, that is a huge number. So here's where I was. And this is why I'm making this video, this podcast. I was at a BMI of 30. I have a positive family history. And at that point, I was not exercising more than 3 days a week, moderate to vigorous. So I already had the diagnosis of prediabetes. They didn't run blood tests at the point, but the doctor says the next time you come in, we're going to start running blood tests to see if your A1C is up and your fasting blood glucose. Just want to throw that out there. Talking about me now. So I had to go from a BMI of 30 to get down to a BMI of 25. And now I hold at a BMI of 26 because I'm extremely active. Because I don't want this thing to rear its ugly head ever in the future. So I'm extremely active. So I have thankfully, I have a high percentage of muscle mass that's developed from swimming and biking and weightlifting. So anyway, let me go through. What are the national costs of type 2? If you don't mind, from now I'm going to call it T2 because there's T1, which is type 1 diabetes, and T2, which is type 2 diabetes. 95% of Americans have type 2 diabetes. Type 1 is more rare. It's autoimmune. So let's talk about the national costs right now. According to the American Diabetes Association, the ADA, which I might use as a reference in the future instead of saying the whole word, 2017 update. 2022 is not out yet. They do it every 5 years. Right now, it's costing $237 billion in the United States. Let that sink in. I couldn't believe it. $237 billion with a B. The cost of people with diabetes accounts for 1 out of every $4 for our healthcare dollars spent in the United States. Crazy, right? Crazy. Direct costs of T2, type 2 diabetes. Medical supplies, doctor visits, hospital care, prescription medications. Now here's something that blew me away. Hospital inpatient care and prescription medications accounted for the bulk of the total of that number, 237 billion. Matter of fact, it's 60%. So the cost of diabetes sometimes is just not, treating the diabetes. It's the other things that happen when you have diabetes, like you get more infection, you can have cardiovascular events, all kinds of things can happen. Renal failure because of kidney damage. So 60% of that total of 237 billion is for those costs right there, the hospital and inpatient care. Hospital inpatient care prescriptions. Now, the remaining 30% of the costs are for anti-diabetic agents that patients use, diabetic supplies, and physician office visits unrelated to the diabetes. So that's interesting. Here's some indirect costs of T2 or type 2 diabetes. This is kind of surprising. I didn't really think about this too much, but for those with type 2, there's a high level of depression, anxiety symptoms. I'm not sure why. I'm sure if we unpack this, we can find out, but that's kind of interesting. There's a loss of overall work and job opportunities that are missed sometimes because of reduction in number of hours a person with type 2 diabetes can work because of the fatigue and the other things that go on. There's also a lot of absenteeism. Matter of fact, I guess they looked at the numbers and they said per year it's costing $37 billion for absenteeism. And that's kind of surprising if you look at the diabetes related disability costs. It's staggering. Productivity for those who work from home, that was also a high number. It's extremely high, the billions of dollars of people that couldn't even work from home because they're sick. So that's kind of the indirect cost of T2. Let's get into demographics, and then we're going to move on to some other, things that are specific to monthly costs. But demographics right now. The first distinction is when it comes to male or female. Males have a slightly higher level for type 2 diabetes. The cost for men per year, the healthcare cost is $10,000. The cost for women is $9,000. So there's a difference there. When it comes to race, non-Hispanic Black Americans face the highest percentage. That we're talking there about $10,000 per year in costs to treat them when they're diabetics. Non-Hispanic white Americans face a little bit less, $9,900, so it's slightly less, not much. I can't explain the difference there. Hispanic Americans face $8,000. So that's kind of interesting. Now they're 66% more likely to get diabetes diagnosis than the average white American. So that's interesting. Probably genetics, maybe some other things, eating habits, whatever, but that's a staggering number in the Hispanic population. Now let's break this down by month. Let's break down the cost per month, because inflation is ridiculous right now. The cost of everything's going up, and why add this number to your budget? You don't want to do it. If there's a way to avoid it, and there is, 40% of the time you can, if you have a diagnosis with type 2 diabetes, that diagnosis can be reversed. 40%. And I think it's a tad higher than that. I think they're being conservative. And even though it's reversed, if you go back to that weight that you had, if you become obese, the diagnosis comes back. So you're going to be re-diagnosed with it again. But we're talking about now being able to reduce that. So let's go through. Depending on the insurance costs, here's the overall thing. For most private insurances, you're looking at $2,400 to $3,600 per year. It could be a tad higher, depending on the type of insurance you have, with the deductibles and everything else. I understand that, and your copays, but that's what you're looking at. Now, overall, what it costs in America for the medical expenditures, the total expenditures attributed to diabetes is $16,000 per year. And of that, $9,600 of that is attributed just to diabetes. So think about that, $16,000 total, almost $17,000, that's $16,752. That's overall expenditures, medical expenditures total. $9,000 of that is just diabetes related. So you're likely to be 2 or 3 times more expenditures if you have diabetes than if you don't. 2.3 times higher expenditures for medical costs. Think about that. That's just staggering, I think. Most private insurances, like we talked about, they're going to cover, some of your costs. But, I'm a pharmacist, and I hear it all the time when they come in. I can't believe what the copay is on this medication for my type 2 that the doctor just added. And then I have to get pen needles, and I have to get testing strips, or I have to get my continued glucose monitoring device now. Yes, I know. And I get sometimes they blame me, and I'm like, it's not me, it's your insurance. So if they really know the actual cost sometimes, and I tell them the actual cost, now what the insurance is charging, what I'm charging today, what the insurance is actually paying for this medication, they're a little bit less apt to be so mad at me and understand that, they have to pay this high copay, but the insurance companies are paying a whole bunch more. So let's go through. I want to take one patient, and this is a patient, let's say it's on the West Coast of the United States, non-insulin, T2. That means he's on some diabetic medications, but not insulin. And he's also not doing continuing glucose monitoring. So let's go through. 4 prescriptions, about $100 a month cost. He's got a pretty good insurance with a health savings account, but he's got a high deductible. But he's paying about $100 a month for the 4 medications. Doctor visits and lab work, another $40 a month. They're usually done quarterly, but if you spread that out, especially the labs, especially if you have a higher deductible, the labs, you have to hit that deductible. So he's spending that much. And then urgent care and other sick care visits that he has to have because of this diabetes, more infection, more upper respiratory. That's another $20 per month estimated, because he doesn't go every month, obviously, but he spread that out. Diabetic supplies, strips, batteries, other related items, lancets, another $40 per month. So this guy right here, we're talking here, he's got about a $200 a month out-of-pocket expense for his diabetes management. And that's not too bad, right? Well, it's $200 a month that he'd rather be spending on other things. Second patient, self-employed. This patient has got a little bit more of a diabetes, type 2 diabetes state that's developed. He's also now having to get insulin, and he's on continual glucose monitoring to keep track, because I guess he's not being controlled very well, but he's trying. He is also self-employed, so his insurance has high deductible. This patient is spending $280 per month, about $3,300 a year. So he's and he does say in this article that sometimes, depending on how he goes that year, he might get up to $4,000. So let's go through his prescription medications. About $65 a month. That's pretty good. He's got a $50 copay for a 90-day supply on a lot of his meds. His insurance is pretty good with that. He gets 7 vials for a 90-day supply at a $100 copay, so about $33 a month. So you're looking at prescription medications, $65 a month. He takes some glucose tablets because he gets some lows and vitamins, another $20 a month. Devices, here's where he's getting ate alive. $118 a month for insulin delivery devices, whether it be pens. They're probably the pens that he's using, not an insulin pump, obviously, but pens. He's also getting CGM, which is continuing glucose monitoring. That's costing him $125 a month. No, I'm sorry, that's costing him $125, about $41 a month. He does everything 90 days. Continual glucose monitoring transmitters, that's costing him another $20 a month because he's got to buy those every 90 days. Supplies, $71 a month. Even though he's on CGM, he still needs to test his blood sugar once in a while. And he's paying of course, another $33 a month. And for his Lancets and other miscellaneous supplies, another $40. So you think about these costs and you say to yourself, okay, the one guy's spending $200, the other guy's spending $280. You're going to look at, if you're a T2, you're going to look at that number of $2,400 to $3,300 per year. Now, that's if you got decent insurance. So I can't imagine somebody that doesn't. But here's the takeaway from all this. It's only going to get to probably, as you're a T2 longer, more medications are going to be added. So that cost goes up. I've seen that time and time again. Somebody starts out with me in the pharmacy. They're on 1 or 2, maybe 3 medications when they start. A year, 2 years down the road, sometimes shorter, they're at 5 and 6 medications. So it only goes up from here. And the danger is there's also other factors that are going to start coming in, other comorbidities like cardiovascular events. You got to watch your kidneys. You got to make sure there's no damage going on there, organ damage, retina. It's not pretty. So why do I harp on this? Why do I keep talking about type 2 diabetes? Well, it's burning up one out of every $4, but also, what if you really leaned in and said, you know what, I'm afraid I'm already probably pre-diabetic, or I'm on my way. I'm going to nip this in the bud now. And all I can tell you is you can beat this. I did. I would have been there by now. It's been 3-4 years now since I've been to healthy weight and changed my lifestyle. I would have been there. I have friends that are there. And I just don't want you to be there. So I hope this video helped. More is coming. All the references are going to be available in the description of this video. And I'm hoping that I have a blog that I can release to you soon too. So until then, get your health on the right track. And don't get caught up where you have to spend more than you're already spending in these crazy inflationary times.